So when I came to Ontario Shores about 11 years ago, we were a fully paper-based hospital, and we saw the opportunity to implement a fully integrated EHR as an opportunity to engage in a clinical transformation exercise.
I remember walking in the hallway and people would be pushing these big buggies, and on the buggy would be a large chart, which would be literally a 2 foot thick chart. And I said, kind of, what's this about? And this is a patient record. And there may be somewhere in that chart, perhaps a foot down in that paper, where there was a drug interaction that didn't go particularly well. And we're probably going to repeat that same thing at some point in this person's care journey with us. And so we began really a focus on, we've got to find a way to deliver that safe, effective care to our patients.
After we implemented our EHR across the hospital, we really focused on trying to implement evidence-based clinical practice guidelines that had an international recognition. So we were able to embed clinical decision support that triggered orders based on how a physician documented. Because the physicians were already used to using the system, it was fairly intuitive for them. The next step was we started to add some exception handling. So if physicians didn't follow the recommendations of the system, they would put in the reasons why, and allowed us to analyze the data. When we started rolling out business intelligence reports where physicians could compare their results on specific quality indicators compared to their peers, initially we said, we're just going to shine a light on practices and no one's going to be able to look at your reports. You can only look at your own reports and you can look at those of their peers in an aggregate form. After about 2 years, there was such a great deal of comfort with these reports that the Medical Staff Association took a vote and they said they wanted to open up the reports for everyone to see each other's performance. So I'd say that through the use of the EHR has created a culture of transparency and accountability that's allowed the physicians to work together to promote improved quality of care for our patients.